CA125 is a glycoprotein often used as a laboratory marker in the diagnosis and monitoring of ovarian cancer. First of all, we have to say that elevated CA125 does not always mean pathology is present. It can be mildly elevated in various physiological and benign conditions. Historically, CA125 became well known for its association with epithelial ovarian cancer. In clinical practice, we use CA125 levels to monitor the effectiveness of ovarian cancer therapy and to check for recurrence after treatment. Nowadays, CA125 is used to track progression of ovarian cancer or response to therapy in patients with ovarian cancer. It's not the most effective tool for screening, and we'll see why. CA125 is produced by mesothelial cells that line various parts of the body, particularly peritoneum, pleura, and pericardium. In ovarian epithelial cells, certain tumor types can express CA125 in significantly high amounts, which leads to a significant increase in serum CA125 levels. It's the reason why we associate CA125 with ovarian carcinoma. The upper limit for CA125 is around 35 units per milliliter. Mild to moderate elevations, up to 100 units, can occur in benign conditions. In contrast to this, markedly high levels, often that exceeds 200 units, raise higher suspicion for malignancy, but it do not confirm cancer, it just raises the suspicion. Now let's illustrate in details how CA125 is secreted and what is the logic of this marker. CA125 is primarily produced by mesothelial cells that line peritoneum, pleura, and pericardium. These cells naturally secrete small amount of CA125. Also, in females, CA125 is secreted by epithelial cells of the fallopian tubes, endometrium, and cervix. This small production of CA125 creates concentration of 35 units, which we consider a normal CA125 concentration. But we know that tumor cells in epithelial ovarian cancer overproduce CA125. Let's say they produce twice as much as normal cells. So, in normal condition, the concentration of CA125 is approximately 35 units. In early stages of the cancer, its concentration can be 100 units. Why it's not 100% cancer? Well, because inflammation of organs, which normally produce this glycoprotein, can also cause increase in CA125 concentration. For example, inflammation of endometrium, which we call endometriosis, can cause increase in CA125 concentration in the blood. Or for example, peritonitis, because peritoneum also produces this glycoprotein. So elevation to approximately 100 units can give not only cancer cells, it can happen in inflammatory conditions. But let's suppose that cancer mass increases, so the amount of cancer cells will be higher. With increase in cancer cells, the production of CA125 increases, which leads to increase in concentration of this glycoprotein in the blood. So now, instead of previous 100 units, the concentration will be 300 units. As we see, the more advanced is ovarian cancer, the higher the level of CA125. We can use this to monitor progression of cancer. The higher the level of this glycoprotein, the larger is the tumor. But, for example, we diagnosed ovarian cancer, and patient received chemotherapy. Chemotherapy kills cancer cells. With decreasing amount of cancer cells, the production of CA125 decreases. So before we had 5 molecules, and now with chemotherapy, patient has 3 molecules. Decrease in CA125 concentration tells us that treatment works. Let's say patient received chemo one more time, so the amount of tumor cells will decrease, and thereby the concentration of CA125 will decrease. And now let's assume that the results show normal level of CA125. Based on this, we can suggest that remission was achieved. But we also should monitor CA125 during remission, because if the level of CA125 will increase, this means that cancer recurrence occurred. As a screening tool, CA125 is not very precise in early cancer stages, because this marker can be mildly elevated in many other conditions. So it's not very specific marker. But if patient has ovarian cancer on advanced stages, this will cause substantial increase in CA125. And if, for example, the level of CA125 is over 300 units, in this case, yes, most likely it's cancer. This marker is typically used alongside HE4 marker or ROMA score, just to improve diagnostic accuracy. And as we saw, this marker is the most valuable to track trends. If it's rising over time, it can mean progression or recurrence of cancer. If it's falling, it's a good news. And here we can see many other conditions that can cause mild elevation of CA125.